Welcome to The PA is In, the show created by PAs for PAs, where codependency with your supervising physician is a thing of the past, optimal team practice is the future, and physician associate has taken the place of physician assistant as the professional title of choice. I'm Tracy Bingaman, and I'm obsessed with redefining what success as a PA looks like and what it feels like. Here you'll find the mindset shifts, systems, and processes I use to escape healthcare burnout and integrate my work into my life. Work-life balance is a myth, and an integrated life where you thrive professionally, not a balancing act, is the goal here. My mission is to help you to grow into a unicorn PA who loves their job, has abundant energy, time to spare, and work-optional financial freedom. The PA is in.
We're going to be doing something a little bit different on this episode of The PA is In. I want to give you a behind the scenes look at one of my favorite CME platforms. As a former surgery PA, I have looked at an infinite amount of imaging studies, and I know that as a new clinician or someone stepping into a new specialty, it can feel particularly overwhelming to be looking at these imaging studies and be expected to know what we're looking at and what we're talking about. So I'm going to walk you through a case on this Guardian Lite CME of an abdominal aortic aneurysm. I'm going to walk you through how you use the platform, how you interface with the imaging, how you use these super important toggling scripts down here that show you detection events of things that you should be able to see after you go through the exam. And I'm going to show you the wealth of imaging and information that exists inside of the library of Guardian Lite. If there is something specific that you do not feel super comfortable with imaging-wise, investing your CME dollars in Guardian Lite is the way to go. If you're anything like me, you like to be well-researched and know for sure that you're getting a good value out of what you're spending your CME dollars on. So without further ado, let's do a little behind the scenes and go through this case together on Guardian Lite.
Are you confident you know where your next dollar should go? 403B, 457, HSA, or Roth? There are so many options. Sometimes it can feel overwhelming. A lot of providers aren't sure if their investment mix is optimized, if they're contributing enough to their investment accounts, or if they're paying too much in taxes. Meet Caleb Pepperday, a fee-only financial planner and founder of Advanced Practice Planning, LLC. Caleb helps PAs create a clear plan of action that allows them to fast-track their path to work-optional living, all while keeping more of what they earn today. Caleb's process identifies the strategies that make the most sense for each PA situation and provides step-by-step guidance to put them into action. For our listeners, Caleb is offering a free one-on-one consultation where he will provide feedback on the steps you've taken in your own financial situation and if you're on track to achieve your goals. Caleb will also help you to determine if your situation warrants needing to work with a financial planner or if you're on track doing it by yourself. Head to advancedpracticeplanning.com/FI to grab your free consultation time slot. These consultations are capped each week to keep turnaround fast. That's advancedpracticeplanning.com/FI.
Advanced Practice Planning, LLC is a registered investment advisor in Montana and Pennsylvania. Advisory services are only offered to clients or prospective clients where Advanced Practice Planning, LLC and its representatives are properly registered or exempt from registration. Registration as an investment advisor is not an endorsement of the firm by securities regulators and does not mean the advisor has achieved a specific level of skill or ability. This advertisement is for informational purposes only and does not constitute individualized advice or a guarantee that you will achieve a desired result. All topics discussed in this podcast are the opinion of the podcast host and not of Advanced Practice Planning, LLC, or its advisors.
All right. First up, we're going to just sort of breeze through these findings here. So if you're anything like me, when you're practicing clinically, you only look at the findings in detail after you've already looked at the impression. So let's hop down here and look at the impression. So the impression reads, ectasia and tortuosity of the abdominal aorta associated with fusiform aneurysmal dilation in its infrarenal segment, accompanied by an eccentric mural thrombosis, notable small infiltration of the contrast medium from the aneurysm lumen through the mural thrombosis at the infrarenal aneurysmal aorta, topography consistent with thrombus fissure, sign of imminent rupture, absence of retroperitoneal collections, Note, small bilateral pleural effusions, inferior mesenteric artery not contrasted. Okay, so here's what we're going to look through. So we're going to scan through this imaging here and just do sort of a general first sweep. So if you are a seasoned clinician, you can probably see where this aorta is dilated, where we're going to get into some of these problems here. So all the way up, we see a little bit of these pleural effusions here, which looks to me like left greater than right, but both are relatively small without a big, huge collection there. Following this aorta down, 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 down. And you do see some of this tortuosity here with some aneurysm. And then here is kind of this money shot of really profound dilation, a little bit of infiltration here. So once I've gone through, I tend to click these detection events, and this will turn on. If you've ever read an imaging study where your radiology colleagues have tagged something, put a little note, pointed something out, put a big old arrow in there to help you find it. Guardian Lite does that for you. So once you go through and you're thinking, hey, do I see these things? Where are they? You can click them on and really say, okay, there it is. Now it's turned on. You can scan up and down and see exactly where it is that they're talking about so that you can feel confident in your ability to point this out. Same thing here. This is infrarenal aortic aneurysm, which I think is, having never seen this patient, likely palpable on exam. So look at this abdominal wall. This is something that you can most likely feel and maybe even be able to see on exam because of this marked asymmetry of the anterior abdominal wall. I think that's a little bit contributed to the fact that the patient isn't completely flat, but also it looks like they do have a little bit of a bulge or a little bit of outpouching of the wall here. That's more clinical than it is imaging. And then this tortuous abdominal aorta is going to take us to a different view. We could see that on the slices that we were looking at, but it's just a little bit more clear here as we look at this film. So you can walk through, you can read, the findings in detail. You can go through each of these studies, scanning back and forth. You can change, size. There's so many different things, just like it would be if you were on the PECs at your hospital, at your office, looking at patient films. You can look at various different slices from different angles. So you can see all of these different imaging modalities and just make sure that you are comfortable with looking at it from different angles, with making sure that you know what you're looking for on these various cases. When you're done, down here, there's an opportunity to put in notes, to offer feedback, and then you click submit. I already did this one today before I recorded, and then you can go on to the next case. Before we go on to the next case, I want to show you a couple of things. So the first is it makes it incredibly easy to track and claim credit for your CME. It generates a beautiful CME certificate for the year that tracks all of your credits earned. You attest that you did them before you review the exam. It adds them up and gives you a nice certificate so you can easily track those CME for continuing medical education tracking and to make sure you're updated for licensure. I want to click down here and show you the wealth of the library of different imaging options that are available. If you look at imaging, you are going to want to see this depth. So for those of you who are watching, it's going to be much easier for you to see this, but I will list some of the options here. So body, there is cirrhosis, fibroids, testicular torsion, intussusception, Budd-Chiari syndrome, hepatocellular carcinoma, staghorn renal calculus, acute pancreatitis, imaging of abdominal aortic aneurysms, which is what we were looking at, renal cell carcinoma, polycystic kidney disease, ectopic pregnancy, extramedullary hepatopoiesis, gallstone ileus, splenic trauma. We have some breast implant and breast cancer. There is a whole list of chest PE, ET tube and main stem intubation, COPD, amiodarone pulmonary toxicity, cystic fibrosis, active TB, tension pneumo, granulomatosis, pneumomediastinum, Pancoast tumors, accidental arterial placement of a central venous catheter, congestive heart failure. And then there's a lot of musculoskeletal cases with things like rheumatoid arthritis, osteomyelitis, fractures, ACL injuries, Paget's, Liz Frank injury. There are neuro cases like glioblastoma, orbital floor fractures, cerebral venous thrombosis, multiple sclerosis, ischemic stroke, and there is a whole section of pediatric imaging. I cannot tell you how incredibly valuable some of these would have been to me as a newer clinician, or even when onboarding some of my colleagues into orientation. So I don't know if you've ever had this experience where you're orienting someone and you're racking your brain for someone who got admitted with a staghorn calculus so that you could tell the person that you were orienting about this case and to show them that imaging and to make sure that they had an understanding of it. And sometimes that imaging is amazing and sometimes it's not so great. So having this in your back pocket where you can look this up, okay, staghorn calculus, where you can view these images, where you can pull it up and share with your orientee the exact imaging and exactly what you want them to be able to see and identify on imaging is invaluable. It is quality imaging. It is some are very obvious, some are more subtle in terms of looking at these and being able to show a student or an orientee exactly what this is going to look like. So the fact that you can scroll through here and see this staghorn calculus and show them exactly what they would need to be able to see.
Are you feeling stuck, burned out, or craving a little more flexibility and financial freedom? You're not alone. So many clinicians feel trapped in the grind, overworked, underpaid, and unsure how to pivot. But here's the truth. Your skills are valuable beyond the clinic. That's why I created the 48 Side Gig Ideas for Healthcare Providers Guide, a free PDF packed with practical, creative, and immediately cash-generating ideas that you can start right now. From telehealth to medical writing and patient advocacy to app development, and even a little note on podcasting, these things aren't fluff. These are real, proven opportunities that other providers are already doing. You don't have to figure it out alone. This guide will help you explore new passions, learn how to make extra money, and make the first step towards multiple income streams and building the life and career you actually want. Download your free copy today at tracybingaman.com/gig or click the link in the show notes and start creating financial freedom and cash flow flexibility on your own terms. Because you, my friend, are more than just your clinical job, and taking the first step to generating alternative revenue streams is waiting for you inside the Side Gig Guide. Find it now in the show notes.
Let's just do this one before we wrap up, because as a former urology PA, this would have been so valuable for me when I was oriented, when I was training new team members, when I had students to look through this with them. So this is a case with a 3.3 centimeter left renal staghorn calculus with moderate hydronephrosis, additional obstructing left renal calculi measuring up to 15 millimeters in the left lower pole, and sub-centimeter a bilateral renal cyst. Bladder is unremarkable on this imaging. So as I'm panning through here, we can see right side looks okay. Right ureter looks to be good and non-dilated, no dilation at that right side pelvis. But the left side, we have some profound hydro. You can see a lot of this swelling inside this kidney, a huge 3.3 centimeter left renal staghorn calculus, and some more stones here in the left lower pole of this left kidney. Having imaging like this, understanding imaging like this, being able to check and double check and make sure that it was read correctly by your radiology team and making sure that you have all of those things reviewed is super, super important. We're going to scroll through on this other view and just say, hey, here's this hydro. All of this swelling you can see right up to the top of the kidney. Throughout, here's the start of that stone. Here's its largest view. And then you can see these stones in the lower renal pelvis. So just like we looked at, we can just confirm our own knowledge and ask it to toggle and show us, did we know where that stone was? Did we see this hydro? Did we identify these things correctly? And we did. And then we just feel confident in our ability to do that. So we can do great case and click submit. And this is going to reload. It's going to give us credit for that. And then it's going to give us more credits over here in terms of calculating, logging that CME. I hope that you take this opportunity to give Guardian Lite a try. I do have a discount code, which I will leave in the show notes, as well as a link for you to try this out. If you like this type of episode, product review, and taking a look at some of the things that people are using for CME, technology, other reviews, certainly let us know in the comments. Send me an email, info@tracybingaman.com, if you would like to see more of this. Thank you, as always, for joining me for another episode of The PA is In. That's all for today. This PA is out.
Congratulations, you've just joined an awesome club. By listening to a full episode of The PA is In, you are officially on the Unicorn PA team. Welcome aboard. What most team members do is they subscribe to the podcast because that allows them to automatically get the latest episode of the show. The life of your dreams exists on the other side of taking action. Keep making small shifts and keep getting better. Your life will improve, your career will soar, and you will have the confidence you need to create your own success. I will see you in the next episode. This PA is out.